Hi, I'm Dr. Fred Marra, and I practice dentistry here in Cohoes, New York, at the Capital Region Complete Dental Care and Implant practice. I'd like to welcome you to our practice today and discuss with you a little bit of information about dentistry. It'll touch on our philosophy of dental care, how we practice, what we do with the patient from the beginning, and how that's better going to serve your needs and ultimately serve to provide a better outcome for your dental care. When a new patient presents to our office, we spend a lot of time getting to know them and getting to know their dental history. That's the first piece of information that we need to begin to establish a diagnosis. See, I believe that the diagnosis is so key and so essential with regard to what kind of care is going to be delivered. I once had a teacher that said this: there is only one diagnosis, but there's a multitude of different treatments that we can impart as a dentist. And if we understand that diagnosis, the rationale and the decision-making tree for the treatment becomes a lot easier. So we really try to investigate, learn, listen, observe to establish that diagnosis. And let's talk a little bit about the diagnosis and how we do it. Before I even get into treatment recommendations with a patient, what I try to do is give them a model of how my wheels turn here, how my brain has formulated information over these last 31 years to kind of collate the diagnosis together. And it's very, very simple. And it works this way. As a dentist, certainly we treat teeth. That's one element of the system. And we treat the disease of dental caries or decay or cavities, as you would know it. And our role is to eliminate the disease and put something back where we took this disease away. There is a decision-making tree with regard to that. We have to decide what kind of materials we're going to use, what's going to best work in that area, how big the area of disease or decay was. We have to look at where in the mouth that tooth is. Each tooth has a different function in that mouth, and based on where it is, there may be a need for a stronger material. We may be able to get away with a weaker material in some areas that will still ultimately facilitate good outcomes. So that's our decision-making tree with regard to treating the teeth. What causes that disease? Bacteria. Bacteria drives, is in our mouth, and certain bacteria in high concentrations will cause dental caries. And again, we have to work with the patient, understand what their social habits are, what their, for example, smoking, alcohol consumption, what their dietary habits are, and what their oral hygiene habits are to better control the disease process in that area. The second element is what we call the periodontium. It's one word, periodontium. Perio means around, dontium means tooth. It's a Greek-derived word. And the periodontium is all the supporting structures that hold that tooth in the head. That could be it will be the bone where the tooth lies. It's a periodontal ligament that lies between the bone and the tooth, kind of a shock absorber. When the tooth is chewed on, there's micro movement in the tooth. And then it's a drape of the soft tissue, the gingiva, the gums, as you would know them as the average person off the street. And we treat a disease called periodontal disease. Again, it's a bacteriologic-driven disease. It is different bacteria in high concentrations that get below the gum and can cause destructive loss of that supporting structure around the teeth. The third piece of the system I kind of envelope and put together as the functional movement piece of the system. And that is the occlusion. And occlusion is just a larger word for your bite. We move our jaw, our lower jaw, up and down, and the muscles in our face, there are certain specific muscles that raise that jaw, there are certain specific muscles that lower that jaw, and the teeth tell the muscles where to position the jaw. And the way the teeth fit plays an important role. The last piece of that movement is the temporomandibular joint right up here. You can put your fingers in front of your ears, you can open and close, you can feel the joint. So those are the moving components of the system. The analogy that I often give to a patient is that it's somewhat like an automobile engine. And imagine this, when you drive your car into the service repair and the repairman lifts a hood, he's not just looking at the parts and pieces, in our case the teeth. He's not just looking at the nuts, bolts, and belts that hold the engine together, in our case the periodontium. He's also looking at the engine and how it's running, the synchronicity of how everything fits and runs. You see, if you drove in and you had a broken part in that engine, it could be that the part just broke. It's a 5-year part, the car's 5 years old, it failed, and it broke. Pretty simple. Everything else is just working and running. But it could be more complex than that. It could be that the part broke, and it wasn't caused by the failure of the material. It was caused by the way the engine was running. So if your mechanic changed that part, and the engine was the piece that created the problem, you're going to be back real soon with another problem. Certainly in the mouth, it's a little bit more sophisticated than that, but I give you that analogy just to make you understand the interrelationship of the component parts and how we have to integrate all those parts together. And that is the diagnosis. And then once that is accurately pinpointed, we can then begin to give care. So we talk to you a lot about your diagnosis, then begin the implementation of this, and this will facilitate a good outcome for your dental health. In other words, you have to do A, B, and C to facilitate a good outcome for your dental health. I think so many times in dentistry and in healthcare, we walk into the dentist or we walk into the physician, they examine us, they might say a few things really quickly, and then tell you, Mrs. Jones, you need A, B, and C. I don't like to practice dental health care that way. I really believe that the patient has to be integrated into their diagnosis, because I think the understanding of their diagnosis is really tantamount to facilitating a good outcome. Imagine if you bought an expensive automobile and they sold you the car, gave you the keys, and locked the hood, and told you, go for it, it's yours, enjoy it. That would be absolutely foolish. And I think that if we, as dental care providers, are just providing dental care without spending a good amount of time to inform the patient, then we've done less than the optimal service for that patient. That's the philosophy of our care here at the office. I will add one thing. We see a lot of patients in the office who come to us and they're confused. They'll sit in a chair and they'll tell me a long history of having seen some other dentists. They'll tell me a long history of difficulties and problems. They know that there is a complex issue that's creating the problems that they're having, but they can't quite put it together. And when I see that, I immediately tune in to separating out, just as I have in this earlier discussion in this documentary, separating out all the different pieces of their diagnosis, and suddenly we see a light clearing event where they begin to understand the reasoning and rationale for what we're suggesting. And that, I think, is so important for that patient. So that's who we are, that's what we try to do, and I hope this small introduction has been a educational experience and a positive impact on you today with regard to dentistry and your dental health.